I'm Dr. Michael Monzel. I'm a gastroenterologist who practices in HCA of Florida. I have been in practice of GI since 1984 and actually involved in GI since 1982, so that's 40 some years. The field involves doing a lot of endoscopic procedures or procedures such as colonoscopies, upper endoscopies, and procedures that involve the biliary tract or all the liver, possibly liver biopsies. Well, first thing I'm going to do when I see a patient is to really kind of get a feeling as to why that person is here. What is the concern? What's the question or issue that has brought that individual here, and then focus on that concern to try and obtain a lot of history about why the person's here and what's brought them here and what symptoms they may have, which could then lead into recommendations what testing I think they should consider doing. At least in our practice, in terms of the providers who are there, I think they can feel assured that their history is going to be listened to and their concerns are going to be listened to. And there always isn't a ideal outcome for everyone, but at least we'll approach things in conjunction with how the patient wants to approach things. I think I'm the most proud of my dealings with how I built my practice, which is to always be there and be responsive to other providers who have concerns and want to refer a patient who has significant problems that they're not comfortable with caring for, and then getting back with them and communicating with them, and also making sure that the patient understands what's going on.